and all the other elements that are associated to treatment. But more importantly, it's about early detection and sensitizing the Barbadian public of the need to be mindful of such. I'm Antoine Williams, and it's my pleasure to introduce those who are at the table. From my far right is Dr. Sahle-Griffith, surgeon, and Dr. Sahle is also associated with Surgical Solutions. The Chief Executive Officer of QEH, Dr. Dexter James, and on my left is the Executive Director of Cancer Support Services, Jan Lynton. Good morning to all of you. This is the month of March, and you may or may not know that this month celebrates colon cancer awareness. And just in case, to give you a background, blue is the official color, by the way. Following my diagnosis of colon cancer, I had a conversation with Dr. Sahle-Griffith, who was one of the surgeons during my surgery. And Dr. Griffith was concerned about the rising increase, or rather the increase as far as colon cancer, of deaths due to colon cancer and the necessary treatments. And if I take you back to that conversation which we had, I remember when I walked through the door and he said to me, "You are the man, you are the one." And that was couched in the context of my being, one, diagnosed, and two, having a public profile. And he thought that it fits well in terms of bringing the message to the Barbadian public, because there's always a story to tell. So I wouldn't be coming from a public service announcement, but more telling the story, and in so doing, convincing and certainly persuading Barbadians to make sure that there's early detection. And so we went about starting the plan, putting it together, and looking at all the mechanisms to ensure that we have it correct when we meet the public. So, in recognizing that month of March is colon cancer awareness month, we thought that this is the ideal time to launch it. And we have also sought the assistance and endorsement of the Queen Elizabeth Hospital, and we will continue in that vein as far as the health institutions, other health institutions are concerned. We are also soliciting support, excuse me, from corporate Barbados. Already we have some interest on board, and the intention really is to have an extensive 3 to 4 month campaign, an extensive one, so that the message is given and it is received and the impact is extremely strong. So that is primarily the background as to why we are here and why we are launching this. I should also make mention of the support of Cancer Support Services. Cancer Support Services, as you know, is a not-for-profit organization, and the element of support is extremely important in this regard. And one of the engines of Cancer Support Services would be to assist in the facilitation of correspondence, the receipt of payments, so that there's that level of transparency as far as the campaign is concerned. But I now want to allow Dr. Dexter James to offer remarks, and following his remarks, Dr. Griffith, I'll invite you to do so.
Okay, thank you, Mr. Williams. My talk will be very, very short. It's sort of the place in the context, the launch today of this colon awareness program initiative. As you may or may not know, colon cancers in men and women rank number 2 in Barbados among all the different forms of cancers. Indeed, worldwide, colon cancer ranks number 3 worldwide. So we feel that the association with this initiative is one that will allow for a higher level of screening in both men and women, so that we can identify earliest persons who might be predisposed to colon cancer. Indeed, cancer, the colon cancer is one of those, like all other cancers, avoidable mortality and morbidity, but it requires us to screen very early. We strongly support screening and early detection as one of the ways in which we could, what I refer to as delay the onset. If we could identify persons who are predisposed to whether it be the NCDs or any of the communicable disease earlier, we can then provide treatment to those patients and therefore mitigate the burden of the disease on society and by extension the Queen Elizabeth Hospital. So we strongly endorse this initiative. We want to suggest that a focus group of men who have had colon cancer or the disease can work together to share concerns and to interest men who are over 40, 45 to go get your colonoscopy done on an annual basis so that we could identify earliest those patients who might be predisposed to it. Very importantly, late last year, we signed off a memorandum of understanding between Queen Elizabeth Hospital and the Cancer Support Services, because we recognize here that breaking the news, or breaking bad news, as you would refer to it, all healthcare providers are not good at that, and we're not set up to provide it. So we have in our memorandum of understanding an arrangement with Cancer Support Services where a newly diagnosed patient, whether it be cancers or maybe persons with renal problems, they can then provide counseling and support to bring you from that stage of denial and grief and anger to that stage of acceptance. Because it is only when you get to the stage of acceptance will the interventions then make sense to the patient. Many times our care providers are providing care to patients and they're still very angry. Many of them are in a depressed state. Many of them are still in denial. And therefore, the interventions that Dr. Griffith and others will provide to such patients sometimes turn out to not be the most appropriate care. So we really need to find, and we're founding Cancer Support Services as one such NGO, an organization that can provide the support to patients who have just received information about their health condition and prepare them from that stage of denial and grief and anger and depression, bringing them to that stage of acceptance, because we feel that once you accept the reality, greater is the chance that you will accept personal responsibility for your own condition. So that's all I really want to say this morning. We're happy that Mr. Williams, as a patient advocate, could see it fit to muster the energy to now assemble a focus group of men and women who either predisposed to colon cancer or may have had colon cancer and are in whose condition is in a sort of remission at this stage. I think if we are able to form such a group and be able to share experiences, you could live, most patients live a very good quality life, and it's not necessarily a death sentence. Mr. Williams, little I know of him, hasn't missed a beat. He's in all the carnival shows and continues to live life normally. So he is testimony to the fact that you could go through that process, get to the stage of acceptance, have a good support structure around you, and then coming out of your recovery, you're here now to tell the story. So we endorse your initiative, and we will support the group, and especially the Cancer Support Services and the MOU we signed off last year.
Thank you. Dr. Griffith?
Good morning, everyone. Thank you for the opportunity to be involved in this, Mr. Williams. Now, I'm going to tell my issues with colon cancer in Barbados. My issues with colon cancer really came to the fore upon my return here. And I noticed that one, the incidence was quite high, and as Dr. James mentioned, we are actually the third highest in the PAHO region. What is to be noted, however, is that we are also amongst the worst in survival. There's only one other country in the entire Americas, from Canada in the north all the way to Argentina, Chile in the south, that has a higher mortality or higher mortality rate from colon cancer than we do. Not even Haiti is at the same level as we are. And I thought this is a crying shame. Part of it boils down to the lack of screening. And so one of the things that's being mentioned by the PAHO group coming out of this is that Latin America and the Caribbean needs to be more focused on screening. What you will notice is that typically people believe that colon cancer is a disease of older people, and it's a disease of men in particular. That is blatantly untrue. In fact, over the last 3 weeks, I have had patients come to me with colon cancer. I think three of them popped to mind immediately, and of those 3, the ages were 54, 53, and 55 years old. Colon cancer is a preventable condition, similar to cervical cancer. It is preventable because it has a long precursor stage. So polyps are what we're looking for. Polyps are actually the goal of colon cancer screening, because every colon cancer begins as a polyp, and it takes roughly 10 years, unless you have some genetic abnormality or a strong family history, for that to move from the stage of a polyp, which is a benign lesion. In other words, taking out that polyp removes the risk of cancer from you, right, to the stage where you have a cancer. What is also recognized is that what we are identifying is people with cancer that has spread. So, if you have a stage 1 colon cancer, that's at the very beginning, so it was a polyp for 10 years, it's now a cancer, your survival with surgery alone is 80-something%. In fact, between 80 and 85%. In truth and in fact, if you have a colon cancer that has spread to your liver, it is not as good with just surgery alone, and we have to give you chemotherapy, and everyone dreads chemotherapy. I must mention at this time the Barbados Reference Lab, and unfortunately I don't think we included them in the group, but I am really going to probably encourage that we do. The Reference Lab has recently introduced a stool DNA blood test. A stool DNA test that allows for the identification of cancers from the stool. It's more acceptable than the colonoscopy. It is cheaper as well, but it is not as good in identifying polyps. It identifies cancer as well, but it doesn't identify what we want to do and identify polyps. So as of 2009, the American Society of Gastroenterologists suggested that the gold standard should be the colonoscopy, in that it is both cancer preventative and diagnostic. And so my hope here is that with time, through the help of the QEH, through the help of Cancer Support Services and the celebrity of Mr. Williams, we can somehow come up with a package that allows for a more palatable discussion with regards to colon cancer. It is not me talking numbers that are going over people's head. It is something that makes people aware that their colons are important and must be checked starting at age 45, whether they are male or female. The screening modalities vary, the colonoscopy being the gold standard, and if normal, can be done every 10 years. The others would be done every year or 2, depending upon what modality is chosen, and that is basically whether we're looking for blood in the stool or we're looking for DNA from cancers in the stool. Barium enemas, I'm going to mention it now because I hope this goes to medium. Barium enemas, as of the 2009 American College of Gastroenterology, has been removed as a form of colon cancer screening, and if it is done, it must be done as an adjunct with checking for blood in the stools, and it is done. The blood is done yearly. The barium enema is done either 2 or 5 yearly. But it has been removed by the American College of Gastroenterology. It is no longer considered acceptable enough, and that is because small polyps are missed on barium enema almost half of the time. And for my part, I'm just hopeful that we get some impact into identifying colon cancers at an earlier stage. And I'm sorry that I'm so impassioned about it, but unfortunately, when you take out about 50 to 60 colons a year, and the majority of those persons have advanced disease, they somehow become a little passionate about the ball, you know? So thank you very much for the opportunity, Mr. Williams and the panel. I hand it over to
Thank you. Just to give you an idea as to how we plan to unveil this particular initiative, of course we're going to be employing the properties of social media. We found that that is a necessary tool, and of course it carries a wider audience. So social media will definitely be utilized, wherein we'll be able to transfer information, we'll be able to use that to certainly sensitize. We will not overlook traditional media, because we also mindful of the fact that there are persons in terms of demographics who are still very much attached to traditional media, and radio does work, so the messages will be used via radio and print. Educational forums, whereas we will focus a lot on social media and have panel discussions and other forums via social media, there are instances where we might still need to speak to persons in a gathering. As a matter of fact, last night I did a presentation at a church. I don't remember the name of the church. And it was the men's ministry. I think it was the men's ministry. And that was overwhelming in terms of the lack of knowledge. I obviously could not speak on from a medical perspective, but interestingly enough, there are a lot of persons who felt that colon cancer is only affected by men. Men are only affected by it. And so at least I was able to dispel that. But there are a lot of persons who want information, who need information, and we are trusting that this initiative will certainly assist. Following my diagnosis, there was the formation of a group or an arm within Cancer Support Services referred to as Conquering Men. And Conquering Men will also be playing an integral role as far as information and assistance in the dissemination of such information. We are excited about this campaign. We are excited in terms of the response, and similar to Dr. Griffith's passionate plea, we are doubly excited in ensuring that as Barbadians that we take care. From a very personal perspective, I have gained a lot of support. The groundswell of support which I have received since my diagnosis is overwhelming. And in a sense, for me, this is almost like a give back, almost a gift in terms of what Barbados has done and Barbadians have done to support me in this journey. I now allow for questions from the media.